Hello, my name is Eva Oriola, and today I will be presenting Hypertension Essential. A typical patient presentation. A 45-year-old woman presents for an annual physical exam. She has no known medical problems but has not seen a healthcare provider for many years. Her blood pressure is noted to be high. When her provider reviews symptoms of essential hypertension with her, she recalls chronic early morning headaches, nosebleeds, palpitations, and blurry vision. She acknowledges that she eats unhealthy food, especially high in salt content. She does not exercise. She has gained weight in the last several years. She notes that she had taken her blood pressure several times in the last few months using an automated machine in her local grocery store and that her blood pressure was high. Etiology of essential hypertension. No identified cause. Family history, genetics, is a contributor. Obesity, when present, is likely a contributor. Some patients are salt sensitive. High salt intake may elevate blood pressure. An unhealthy lifestyle may contribute, lack of exercise, or poor diet. Here are multiple causes of high blood pressure. Transient high blood pressure can occur with stress. Secondary hypertension is high blood pressure due to an underlying disease. And essential hypertension is persistently high blood pressure without a medical cause. Here are some examples of diseases that can cause secondary hypertension. Polycystic kidneys, which is cysts around the kidneys. Pyelonephritis, which is inflammation of the kidneys. Primary hyperaldosteronism is too much aldosterone produced by the adrenal glands. Cushing syndrome is a syndrome leading to high cortisol levels. Hyperthyroidism, diabetes, and renal artery stenosis. Classification of hypertension. Normal blood pressure, systolic, less than 120 mmHg, and diastolic, less than 80 mmHg. Elevated blood pressure, systolic, less than 120 to 129 mmHg, and diastolic, less than 80 mmHg. There are two stages of hypertension. Stage 1, systolic, 130 to 139 mmHg, or diastolic, 80 to 89 mmHg. Stage 2, systolic at 140 mmHg, or diastolic at least 90 mmHg. Essential hypertension background. It can cause in adults of both genders. In the United States, about 47%, now that's 116 million, of the population have essential hypertension. 1 in 4 adults with hypertension have it under control. About 37 million adults with hypertension do not have their blood pressure controlled. Here are some risk factors that can cause high blood pressure. Family history, obesity, stress, excess dietary sodium, physical inactivity, alcohol use, or tobacco use. The pathophysiology of hypertension is that the pathogenesis of essential hypertension is multifactorial and highly complex. The disease involves the interaction of multiple organ systems and numerous mechanisms. Thickened blood vessels, and factors that play an important role in the pathogenesis of hypertension include genetics, activation of the sympathetic nervous system, activation of the renin-angiotensin-aldosterone system, and obesity. Here are vascular changes with elevated blood pressure. Major changes are in the small arteries, especially in the kidney, intimal thickening and duplication of the elastic lamina, elastosis, accentuation of vessel aging, and leads to the complication of poorly controlled hypertension. Here's a picture of hypertension complications. I will explain to you this picture more in detail. Now, you can see two different types of blood vessels. On the left side, we have a normal blood vessel. And on the right side, you can see the damaged blood vessel, which is caused by hypertension. And you can see how the blood vessel gets narrow and stiff, and it's all cause of the complication of hypertension. And also, Hypertension can also cause a stroke, a heart attack, and kidney damage. Complications of poorly controlled hypertension are cardiomegaly, especially left ventricle hypertrophy, cardiac rhythm abnormalities, myocardial infarction and or congestive heart failure, renal damage, stroke, metabolic syndrome, and dementia. Here are symptoms of hypertension. In the early stages of essential hypertension, the patient may have no symptoms. The presenting symptom of undiagnosed essential hypertension might be catastrophic, such as a stroke. With blood vessel damage due to essential hypertension, symptoms may develop dizziness, blurred vision, chest pains, or headaches. Diagnosis of hypertension. At least two, many experts recommend three, measurements on at least two separate occasions. Two measurements during each visit at least 1 to 2 minutes apart. The patient should remain seated quietly for at least 5 minutes before taking the blood pressure. Ambulatory blood pressure measurement is the most accurate method to diagnose hypertension and identifies individual with white coat hypertension caused by the anxiety of being in a medical office. Here are some treatments for hypertension. Lifestyle changes. You can avoid alcohol, tobacco use, and caffeine. You can also have a healthy diet, exercise, weight loss. There are also medications, diuretics, which removes excess of fluid and sodium. Beta blockers help slow down the heart rate and protects the heart by having another heart attack. Vasodilators help maintain the blood vessel. Muscles are relaxed, allowing blood flow. Thank you.